Free Hesi Pharmacology Practice Test. Question 1. Which of the following is the antidote for benzodiazepine toxicity? Flumazenol, methylene blue, deferoxamine, alkalinized urine. Flumazenol reverses benzodiazepine sedation. Question 2. A client has a new prescription for timolol eye drops. How should the client prevent systemic absorption of the medication? Bony orbit, nasolacrimal duct, conjunctival sac, outer campus. Applying pressure to the nasolacrimal duct reduces systemic absorption. Question 3. A client on bicalutamide. What adverse effect? Muscle pain, flushing, gynecomastia, hyperglycemia. Hormonal effects cause breast tissue development. Question 4. A client has been prescribed a calcium channel blocker for angina. The nurse knows this medication should not be used with caution in combination with which drug classes? NSAIDs, cardiac glycosides, beta blockers. None of the above. Combining with beta blockers can cause severe bradycardia or heart block. Question 5. Filgrastim adverse effect? Bone pain, RLQ pain, lung crackles, heart murmur. Bone pain is a common side effect. Question 6. A carbose monitoring? WBC, potassium, platelets, liver enzymes. May cause liver dysfunction. Question 7. Gentamicin toxicity sign? High BP, hematuria, low urine, high RR. Indicates nephrotoxicity. Question 8. When administering subcutaneous enoxaparin 40 mg, what action should the nurse take? Expel air bubble, insert needle fully, inject in thigh, aspirate. Full needle insertion ensures proper deep subcutaneous delivery. Question 9. Which drug reduces mortality within 8 hours of MI? Antiplatelets, beta blockers, ACE inhibitors, calcium blockers. Beta blockers reduce cardiac workload early in MI. Question 10. Fentanyl patch teaching? Non-hairy area. Change 72 hours. Avoid heat. Do not cut. Heat increases absorption risk. Question 11. A client with angle closure glaucoma. What finding is expected? Painless vision loss, peripheral loss, severe eye pain, normal pressure. Acute glaucoma presents with severe eye pain and increased pressure. Question 12. Atenolol should be held for which vital sign? RR12, pulse 52, BP 134/72, O2 95%. Beta blockers lower HR, bradycardia is a contraindication. Question 13. Why prescribe ACE inhibitors after MI? Lower potassium, reduce mortality, always combined. Treat hypotension. ACE inhibitors improve survival and reduce cardiac remodeling. Question 14. A healthcare provider is assessing a client who is taking levothyroxine. The healthcare provider should recognize that which of the following findings is a manifestation of levothyroxine overdose? Insomnia, constipation, drowsiness, hypoactive reflexes. Overdose causes hyperthyroidism symptoms like insomnia due to increased metabolism. Question 15. Irinotecan adverse effect? Diarrhea, hypertension, ototoxicity, neutropenia. Severe diarrhea is hallmark. Question 16. Paclitaxel adverse effect? Bradycardia, diarrhea, neutropenia, urinary retention. Myelosuppression causes neutropenia. Question 17. Albuterol PO side effect? No use in attack, tremors, hyperglycemia, growth delay. Beta agonists commonly cause tremors. Question 18. Which drug is associated with Stevens-Johnson syndrome? Valproic acid, quinidine, isoniazid, ethosuximide. Ethosuximide may cause severe hypersensitivity reactions. Question 19. Amoxicillin plus clarithromycin teaching? Take with food, black stool, photosensitivity, decrease acid. Food reduces GI upset. Question 20. What is the first medication type prescribed to prevent angina pain? Beta blockers, alpha blockers, calcium channel blockers, nitrates. Beta blockers are first line to reduce oxygen demand of the heart. Question 21. Cisplatin adverse effect? Tinnitus, nausea, constipation, weight gain. Ototoxicity presents as tinnitus. Question 22. Prednisone monitoring? Potassium, calcium, sodium, glucose. Causes hyperglycemia. Question 23. Allopurinol teaching? Increase water. Take fasting. Limit vit C. Take iron. Hydration prevents kidney stones. Question 24. Ceftriaxone teaching? Cough. Stop rash. Oral form. Yellow urine. Rash may indicate severe allergy. Question 25. Potassium-sparing diuretics act where? PCT loop, collecting duct, distal tubule. They act in distal nephron to conserve potassium.